25,000 vials of the vaccine, human immunoglobulin, made from human blood had been ordered, and over 3,000 of them were accepted by the Medical Supplies Division. Around $3 million had been spent to purchase these vaccines. That is almost 1 billion rupees. The more pressing concern is that this drug has been manufactured in Sri Lanka without any legal approval. The National Medicines Regulatory Authority repeatedly said a forged document was submitted stating that the drug was exempted from registration as an emergency purchase. The company that supplied this stock of drugs also did not have legal approval to produce any drugs in Sri Lanka. Despite all of this, the stock of medicines had been accepted by the Medical Supplies Division and then distributed to hospitals in the country. The Health Minister today revealed to Newsfirst that the drug purchased is not human immunoglobulin.
අපි දන්නේ නැහැ මේ රෝගීට දීලා තියෙන්නේ මොනවාද මේ සංයුතිය මේක තිබ්බ කියලා. එතකොට
that is being tested at the lab. They are of the opinion that fortunately there is no adverse chemical in this. What has been given is something similar to saline.
saline දාලා තමයි $100 ගාන විකුණලා තියෙන සෞඛ්‍ය අමාත්‍යාංශයෙන් වල.
Yes, that is what they have put into it. The next bidder had offered this at $300. The CID is conducting a massive inquiry into this. I spoke to the DIG and he said that the facts will be reported to court.
The documents are fake. The medicine is fake. The company that produced the medicine is also fake. How does the Medical Supplies Division purchase a drug like this?
The NMRA is saying that they have not issued any license for this medicine. They say that a forged document has been used. When we take into consideration all of these facts, we can conclude that this is a forged document.
bid document වල තිබ්බ කාරණේ අමුද්‍රව්‍ය ගෙනල්ලා මේ මෙඩිසින් එක ලංකාවේ හදනවා කියලා ඒගොල්ලෝ bid document වලම දාලා තිබ්බා. සමාගමට ඇත්තටම එහෙම හදන්න ලංකාවේ බලපත්‍රයක් නැහැ.
I asked for this company to be inspected and they are not in any position to be issued a license to produce this drug.
එතකොට අපතුමා දැන් bid document වල මේක තිබිලා තියෙනවනේ ඉන්දියාවෙන්.
I don't know about that. This is being checked by Dr. Ratnayaka in the evaluation committee. That must be cleared from there.
රෝගීන් කී දෙනෙකුට විතර දීලා තියෙනවද?
Everything was withdrawn. Only 3,085 was issued out of the 22,500. More than 200 vials from these 3,085 vials have been withdrawn.
Who is to be held responsible for such a serious mistake?
Yes, an internal investigation is ongoing. The first thing to do is to analyze the medicine. If we can't do that in Sri Lankan labs, we will send it to a globally accepted lab in India or Australia and we can get down those lab reports. We are concerned about people suffering complications after being administered with this vaccine. Currently, they believe that these vials are filled with saline or a similar substance. We have an issue with the vials that they submitted as samples. Those responsible will have to provide answers.
එමතුම අපිට තොරතුරු ලැබුණා මේ MST එක ඇතුළේ ස්ථාන මාරුයි අභ්‍යන්තර ස්ථාන මාරුයි වගේක් දීලා තියෙනවා කියලා.
A decision will have to be made. I am waiting for the initial report. We will have to take a decision to remove certain people from their positions, even temporarily.
මේ ඇතුනේ බරපතල තත්ත්වයක්. විසින් පරීක්ෂාවකින් තොරව ක්‍රමවේදයක් නැතුව ඇවිල්ලා රෝගීන්ට වෙනකම් මේක ගිහිලා තියෙනවා.
We have decided to suspend emergency purchases. We have suspended granting waivers. There is no issue there. That was the reason that led to this issue. There is no pandemic. We will not grant waivers.
This was the vial that was purchased at 42,000 rupees each. Can responsible officials use taxpayers' money to purchase substandard drugs and also put the lives of the general public in jeopardy? Can responsible officials who use taxpayers' money to purchase substandard drugs and also put the lives of the general public in jeopardy go scot-free? Can those responsible shirk their responsibility by saying, I stopped this and that someone else is responsible for it? Why is there a delay in bringing those responsible for this crime before the law?